So I think just to sum up, we talked a little bit about some of the decision process that's made in deciding what sort of research we work on. We talked a little bit about neuromodulation, which is the idea to get anywhere near the same benefit of deep brain stimulation, but without an operation. Again, this is very early days yet, but because it's so safe and it's inexpensive, we're pursuing that with great vigor. You heard from Ravneet about patient monitoring, and again, this is a very interesting area that we're looking at. And I talked a little bit about neurobiofeedback and myelin imaging. So I think I'll end there, and I'd be happy to answer any questions if people have, once I figure out how to stop screen sharing. There we go.
So there are a couple of questions in the chat box, Dr. McKeown. Would you like me to read them to you, or would you like to read them yourself?
Yes. Yeah. One of the questions is about the leukemia drug. I'm not aware of any groups in Canada doing that. Again, it's kind of deciding, as you know, if you look at the Venn diagram of the intersection, I don't know of any groups that are actually tooled up to do that. I do have an anecdote from that there was a visiting fellow we had from Spain, and she had actually used that drug on a leukemia ward and had many people with complications with that. And so she said it was a very potentially dangerous medication. So I think, like all things in medicine, I always tell people, whenever you think about a therapy, you weigh the risks and benefits. And if the potential benefit is great, then it makes sense to go through higher risks. So at this point, I think the risk-benefit ratio of that is still being worked out. And Broxol, again, I'm not familiar with anyone in Canada doing that. Can PD cause edema also on the right hand? My neurologist and physician do not know. Yes, it can. There are some group of PD medications, particularly the dopamine agonists, which these are the drugs that you may have heard are associated with gambling and impulsive behavior. Those ones are notorious for causing edema. There's another medicine that's sometimes used for the dyskinesias called amantadine, and that can cause edema. If it's asymmetric, though, it's always a bit of a concern that it might be related to something like a blood clot, and that's why you want to go to your family doctor. With regards to the arm, again, that's less common, but if you have a very stiff shoulder and you're not moving it around, remember a lot of the things that induces venous drainage is physical activity. And so if you have one side of the body that's not moving, it is possible to get more edema. But there are certainly other causes for edema, and that's why not everything is always Parkinson's. And so it is very important that your family doctor examine you for other things, such as a blood clot. When do you think vestibular stimulation will be available? Well, we're recruiting now. I can tell you that we were just awarded a 5-year grant from the Government of Canada through CIHR, the Canadian Institute of Health Research. And that grant was specifically to be able to customize the song. So I think that's a reasonable horizon. But the good news is once we can sort out how to optimize the song, we've already got the design and some prototypes built of the portable stimulator, so we can hit the ground running. Can I say a bit more about the microbiome gut research? Sure, this is a very hot area. I don't want to speak on behalf of my colleague because this is really Dr. Cresswell's area, but I'm certainly happy to mention a few things. So this is a very hot topic, as I briefly mentioned, that a lot of people think that Parkinson's now starts in the gut. There's some interesting anecdotal reasons why that would be. For example, if people have had their appendix out, they're at a lower risk of ultimately developing Parkinson's. Before we had good stomach medicine for acid, one of the treatments to treat ulcers was to cut a nerve called the vagus nerve. And a study in Denmark found that the people who had that vagotomy procedure had a much lower incidence of Parkinson's. So the idea is, and the third part of the story of that is, when they started doing some of the genetics, one of the surprises was the genes for some of the familial Parkinsonian syndromes also were associated with gut diseases like Crohn's disease. So there's a lot of interest in that. More recently, Dr. Cresswell and her team have published saying that the type of diet that you're on, particularly the Mediterranean diet, may be useful and may be different between men and women. It may benefit women more than men with this particular diet. We are actively recruiting people to have their microbiome tested. So if anyone is interested, feel free to contact the Movement Disorder Clinic at UBC because it's in early days. The reason why this is exciting is you can manipulate the microbiome with probiotics and judicious use and selective use of antibiotics. So the fact that you can potentially manipulate the gut microbiome makes it a particularly exciting area. So how do research groups avoid duplication in different countries? That's a very good point. And the way we do it is we all publish in international journals. We go to international conferences. And I think in this day and age, everything's so international with the internet and so on. It would be very hard to publish something that would be a duplication of what someone else had done. Just the work would never get published because they would say this was already being done by a group in Germany. So I think that's why the first thing that we do before we set out on things is make sure that we're not reinventing the wheel. We have to make sure that we're doing something that's unique and contributes to the field. I'm interested in more info about the microbiome gut research as well. Again, if you contact the Movement Disorders Clinic at UBC, they will be able to talk to you about the microbiome gut research. Do you think there'll be another medication that will replace levodopa in the future? Well, levodopa is a precursor to dopamine, and so it's pretty hard to beat it. Where I think you may get some developments is in the delivery of the medicine. So the natural state of levodopa or dopamine in the brain it's relatively constant. And it's artificial to take a pill where the medicine comes in and wears off and comes in. That sort of up and down is unnatural and may not be good. And so there's theoretical benefits where you want to take smaller doses more frequently than big doses far apart. Many of you may be familiar with a treatment called duodopa, which is essentially a gel form of levodopa that is continuously infused into the gut. Whoever can solve transdermal, like if you could put a patch of levodopa, that would be a huge boon, whoever can figure that out, because that's ideally what we would like. So have we covered everything there, Alana? I think.
Yeah, I think so. I think that was the last question. I think we could probably wrap things up if nobody else has any questions that they're typing, and I don't see anyone typing right now. I'd like to thank you very much, Dr. McKeown, for putting on such an interesting presentation for us today. And also thank you, Ravneet, for speaking as well. And thank you all for participating in your great questions. Very interesting. And I look forward to seeing you all for our next talk. Can you hear me, Dr. McKeown?
I can hear you. Yep.
Oh, okay. Someone said that there was no sound.
Yeah, no.
But anyways, thank you all for attending, and I will see you at the next March Symposium talk. Unless you want to quickly answer this last question, Dr. McKeown, I think we can wrap things
I'm very
up.
familiar with Nupro patches. So this is a medicine called rotigotine. So it's a patch, which is good, but it is a dopamine agonist. And so there are some downsides to this dopamine agonist. It's good for people at night because the medicine could be absorbed throughout the night. but it is part of the agonist family, and they're more likely to cause confusion, particularly if people who have some pre-existing cognitive problems. They can worsen the drop in the blood pressure. They are associated with the impulsive behavior and so on. So the patch form is good, but Nupro patch is sometimes useful, but what we would really like is the levodopa patch, I think. So.
Okay, great. Thank you so much. Have a great afternoon, everyone. Thanks again. Bye-bye.
See you. Bye-bye.